We know that across the world there's feminization of health professionals. Traditionally, nurses were largely women, but across the board, in terms of most of the profession, there's a massive feminization of the health professionals, as well as the feminization of higher education. And yet we fail to see women in leadership positions, both in business, but specifically in health and higher education. My role as the Vice Dean of Clinical Services and Social Impact started in 2006 when I was appointed during the restructuring of the Faculty of Health Sciences. And as far as I know, I was the first woman of color in the deanery in, at that time, 50 years of the Faculty of Medicine and Health Sciences. If I look at my journey and my career, and I'm specifically focus on the question you asked about social justice. I'm a first generation university student in our family. When I was in grade 9, standard 7, my goal was to be a nurse because we had lost my mother when I was just shy of 6 years old. And I thought I wanted to be a nurse like the woman that nursed my mother. And I was told now I was too clever and I should really be a doctor. I was at the high school between 1976 and 1980, which was the time of the school boycotts. And in fact, when I was doing my matric year, our school was interrupted. We didn't go to school for the majority of my matric year. And then I applied to go to medicine. And in 1981, I started medical school at UCT. I was one of the cohort of students at UCT that still had to apply for a permit because if you were a person of color, you had to go to a university for your racial group. My parents, my mom and dad lived in an area in Cape Town that was declared white in the early 50s, and so our family were removed from the area. So my whole career, my life has been marred, I suppose, and we've been victims of the apartheid system. And so I suppose that really positioned me to consider a number of things. So my first part of my career, I really worked with individuals. Then I moved up in the system and started to manage health services, and then at that time looked more after the community health needs. And now, in fact, I've come the full circle because now I'm training the next part of the university and training the next generation of health professionals. Part of my role is to ensure that we have a good partnership with the health department. And so since I started in 2006, I've been working with the other universities in the Western Cape with the Western Cape government to develop our agreements. And after much pain and suffering and many versions of the agreement, we signed a multilateral agreement in 2012, and I was the lead person from the university on behalf of the 4 universities to get the multilateral agreement signed. And then it took us another 10 years, again, lots of difficult times for us as a university to sign our bilateral agreement. A second aspect, which I'm also very proud of, is where and how we train our students. We've developed what we call the distributed training platform. This is where we take our students outside Tygerberg Hospital to schools, to social services, to underserved areas, and specifically to rural areas. So I was part of the team that developed the rural clinic, the first rural clinical school in South Africa, and we're very proud of the work that we've done in that particular environment. The third area that I want to speak to is my work in the transformation space. So if you come to our faculty in Bellville, you will see as you walk into our building the preamble to the Constitution. As part of our transformation work, we said all we do is we have to be embedded in the Constitution of South Africa. The second bit of transformation work in the student space is that we worked with the student leadership, the programs, the various undergraduate programs to develop the entry commitment. So students come into our faculty in first year, in the first semester, they commit to being a health professional student. It helps them in terms of their professionalism, in terms of their behavior, in terms of the respect they have for each other and then for patients in the future. And so again, with the program leads and with the students, we developed what we call our student interdisciplinary pledge. And so our students read that together at the day before graduation to pledge to their colleagues, to us as a faculty, to their families and friends of how they will then go forward as practitioners committed to ensuring the safety of patients, looking after themselves, respecting each other. And then the last aspect of my work in the transformation space is more recently we're working on the Hartekraaltjie historical cemetery, which is located on our premises. And so part of our project is really to look at the lost space. So we've all forgotten that the cemetery was there. Evoked lots of memories for both the community of Ravensmead and other communities who had loved ones buried there, but also like myself in terms of forced removals and many of the colleagues who've actually engaged around the cemetery, around how forced removals have actually affected all of us in different ways, in different walks of life. And then I think the last highlight for me is the transformation of academia. I've been on the appointments committee of the Senate. I think I'm the longest serving member at that committee for 13 years of my 18 years. And so the appointment committee ensures that we drive policy around change, bringing more women into the academic space. And with the previous dean, Professor Jimmy Waldmink, we worked closely to drive transformation, both in the support environments as well as in the academic environments. And it was under his leadership that the first Black African professor at that time would have been 65 years or 60 to 65 years of Stellenbosch University. The first Black African professor, Professor Minyana, was appointed in our faculty. So I think my advice to young women is that we can do it. We have the ability, we've got the skill sets, whether it's the intellectual skill sets, whether it's our emotional EQ, IQ, and we have to ensure that we give each other as women spaces to grow. One of the things I always say to my colleagues, young and older colleagues, is you can't do it on your own. So you have to partner. All my work I've done in the faculty, in my career, is around partnering with others. You cannot do it on your own. So find those who have your same value set and partner with them. And secondly, men have been doing this for years. They've been playing golf, they've been doing things together and networking. And as women, we have to grow our networks. And those networks could be social networks, it could be professional networks, it's just those go-to networks. You know, we have friends from in our young lives, we have friends as we grow older and mature, but use those networks to support each other and never give up. So one of the areas that I have to actively manage is that our patriarchal society will always see women, like myself, as aggressive. I want to just rephrase that as being assertive. So we have to be assertive, we have to never give up, and most of all, we have to help each other grow.